Well, I mean, I sort of am groggy when I wake up a little bit, but then nurse came in and asked me if I wanted coffee or anything. I said, oh, yeah, I can have some coffee. Yeah, I was more thirsty than hungry. And because I was groggy, the sound of coffee was wonderful, you know, and I didn't realize, oh, I can have coffee. It's okay. It didn't matter. It wasn't restricted. So that was very reassuring. I really wasn't nauseous or anything. I was fine. I was just sort of, hello, where am I, you know? I stayed with a friend, and thank goodness. I mean, I was going to go home in 2 days. I stayed there for 6 days. So that was another thing that sort of, I didn't realize just how much it took out of me. The surgery, even though it was arthroscopic, there was a lot done. I wore the dressings for 48 hours, and I didn't know what to expect when they came off. But it was really, I mean, it looks like little cuts, you know. So could not shower for 48 hours. The first shower, I had my friend stay there. I was a little nervous just about getting in and out, but it was fine. I didn't have, I mean, I stayed with my friend for 6 days, and then I went home, and I was on my own, and it was okay. I did fine. I had made a lot of things, and my friends cooked for me. And I had frozen foods, and I prepared for it, so I would not have to deal with it. I didn't want to cook. Physical therapy was, you know, I was expecting the worst, and it wasn't. There were times when it was hard, and when the therapist massaged me, it started out fine, but as it got deeper and deeper, that could be a big owie. And I had a hard time relaxing my arm, which made it worse, because what I think is relaxed is really not. So I had to learn how to do that, but I found it challenging, but not as painful or as difficult as I thought it would be. I have been through physical therapy before, so I sort of know that it builds as you're able to do more things or it's further away from surgery. But it was interesting to go from very gentle, assisted, to then going for it on my own. I'm still doing exercises. Some are still difficult, especially when I'm doing weights. The therapist tried even a 1 pound weight, and it was too much. So I do use a soup can to do some of the exercises, but a tiny little Fancy Feast cat can to do this one that I go like this, and like that. That is difficult. Using the bands is wonderful. I really enjoy that. It feels good, you know, so, and that's strengthening, I would think, also in flexibility. So I could do those all day. Well, one of the best pieces of advice I got from other folks who had rotator cuff surgery was purchase an ice machine, which I did from a friend. And that was wonderful to have the ice on all the time. It's a royal pain in the neck. You can't do it yourself. You need someone else to help. And it drips and it does everything. But it is well worth it. You know, we're told nose to toes movement and not moving out at all. But so I try to eat, because I'm so left-handed. Eating with my right hand was really interesting, but it was a little difficult. And that lasted for quite a while, actually. I'm just now comfortable. I am, it was March 10th, April, May, June, almost 4 months? 5 months, yeah. So beginning to notice differences and ease. I still have pain at times, you know, but I think that goes with the territory.
Right. How long did your surgeon tell it was going to take before you were fully recovered?
6 months to a year. My physical therapist said a year. She was adamant about that, which is fine, you know. As long as I can go to Paris in October, I'm fine.